nothing visceral or profound for you. I am a turd in a flower garden. I want to thank whoever organized this for putting my turdness amongst these flowers to truly draw out the contrast. It would have been clear, but you nailed it. So I'm going to talk about something as emotional and profound as Uber and pager. And the basic intent of my life, it turns out, is to kind of Rodney Dangerfield the beauty of medicine, to spread it out break down the walls of the country club and let the masses access what's available. And it's unclassy, but it's essential if we don't spread the expensive resources of healthcare and use them over a broader base of people. Then we will find one day, oh wait, maybe it already happened, that we can't afford it. And then we'll have a crisis. So here we go. We'll talk a little bit about what I'm seeing in the world that I'm hoping will chisel its way into our marvelous healthcare system. Here it is today. I won't belabor it. All the PowerPoints on how much it costs and how lame it is. I won't remind you that 1,324 is the number of faxes that physicians get each month in the United States today, after $50 billion or whatever we've spent on computers. Or that here in the Bay Area, the home of the internet, there are almost 200, there are 198 separate, disconnected data centers, each one saying, I'm the center. No, I'm the center. No, I'm the center. I'm the center. I'm the center. Yeah, I won't. What we have in mind, of course, is this idea of a network, where when you develop a node, an invention, a ventilator, when you put up an X-ray machine, you can raise the flag and be able to engage in a demand curve, engage in a I'm sexier, I'm more present, I'm cheaper in a marketplace, which will allow you to grow and be different and be better, have some meritocracy, but also have some human power available to patients. The biggest problem I always have with healthcare is not that it's expensive. That's my second biggest problem. It's that for all that money, we can't trick it out. We can't use it as an expression of ourselves and, meet someone like, I'm full risk. How are you? I didn't push it hard enough. Internet, yeah. So I'm into this internet thing. I really think, he said at Stanford in 2016, the internet is going to be big in healthcare. So let's look at the things that the internet has done. Let's break down a mechanical mechanism. Now, we're not going to do a policy. We're not going to do a whiteboarding and then make a rule and have a grant. We're going to think about the underlying ego, gravitational pulls that have pulled the healthcare. We're going to start post-porn because that's what got us the speed and the ability to deliver images. But what else that we've got in our lives have been pulling the internet out into the more complicated, esoteric, isolated sectors of our society? The first is administrative automation. In our lives, as we get more protective of individual rights and as we get more out into the details of people's lives, we have a lot more information that we'd like to manage a lot more carefully. Right? As we get more regulated. This is a normal progression of things. It is a sign and symptom of becoming wealthy and careful, and it's okay. But the internet has helped us accommodate more and more and more administrative complexity without bogging our lives down and down and down. As our you register once, and then the next time you register, you just say, yeah, fine, use Facebook or whatever. Network knowledge is the next thing. We can see. It started, of course, with, burritos near me, but it's gone further than that. Our ability to allocate resources and to access other people's resources has been exploded through the use of the internet. And the last thing is, I got it backwards. That would be the third one. The second one is this idea of spreading knowledge quickly. We accumulate, as a society, think of all the knowledge we accumulate without being able to read each other's exhaust online. When you add the exhaust that we can study, the amount of information available to any one of us is overwhelming. And what the internet allows us to do is hyper-slice, hyper-subsegment to get down to your feed, your little thing that you know you need to see this dog carry that cat up the stairs and lick its head. We have used the internet to get that right. You're welcome. So how are these business models working? Let's go through a few examples to get our juices flowing. Then we'll go to healthcare and see whether we see some things starting to come about. And you'll see that it's not coming about as fast as we'd like. And then you'll all go start the businesses that will do it. And we'll all be glad we came. Airbnb. We got our three things, right? Network knowledge, administrative automation, and resource allocation, right? So Airbnb accessed thousands and thousands and thousands of rooms of excess capacity of society, made them available. How'd they do that? Well, first, they made it really easy to administrate the process of turning your house into a hotel. Here's where you take the pictures, here's where you put in the size of the square feet, and then we use network knowledge to go in and say, here's what on this day of the year, based on the conferences going on in your town, what you'd probably need to charge in order to fill the room. And if you use the Airbnb price advice, you are 4 times as likely to fill your room as if you don't, right? So first thing, really easy to sort of walk around with your iPhone and register your house as a hotel. Second thing, really easy to, based on the exhaust of all the other people choosing all the other apartments like yours or houses with balconies, with grills, hot tub, yes, no, right? To figure out the right place, enough network knowledge to figure out the right place for what you're doing. If you didn't get a grant, right? Just actually as you sit. And the last thing is, you can reallocate resources. Your house is empty. It still costs you. Now you can make it full, not for maybe as much as if you had marketed it and turned it into a hotel and agreed to the hotel registration. That is the magic of the thing. Only side thing worth noting, and I want us to keep this in mind as we move through, it is quasi-illegal. Most cities have hotel boards, and Airbnb has sort of side-slipped much of the cost of being in the market of renting rooms. Ways. You understand the administration here? No administration. It takes purely the administrative exhaust from you having an iPhone and saying, let me use the identity and administrative work you've already done to be on your iPhone. Just let me trickle along and follow you when your app is open wherever you go, right? Network knowledge, we now know better in ways than 911 where the accidents are. We are essentially an unauthorized competitor to the 911 market. We are also an unauthorized competitor to the local public works departments, who are horrified to find out all the people that are now using their roads. Because when I-95 is blocked, Waze says, yeah, screw it. The town of Belmont's got a great main street and nobody's on it right now. And there's the guy at Belmont, what the hell is going on? And all these people are going by. What was the last one? Oh, the resource allocation. So we all get to use that underutilized road that we bought. Uber, of course, you get all three of these here. 160,000 drivers, 3-minute average wait time. We know this, and completely illegal. Absolutely fangul to the Taxi and Limousine Commission, right? I want to study the mechanism here of Uber, but you can see it in all of these. I want to just drill into how Uber got born and how it got spread, because I think it's an important mechanism for us to try to find in healthcare. It starts with the black cars. Think of them as like the academic medical centers of transportation, right? Unbelievably expensive and mostly empty, right? But when you need it, man, it's there. Bomb goes off, whoop! Choppers, unbelievable, right? Unbelievable experience. You want to feel like a, minor dictator? Call up a car service. Should not have correlated the minor dictator to the academic medical center. That was not what I meant. You got this idea. Very expensive, very rarely used. The guy he has his 5 a.m. run to the airport, sits around for 4 hours, then he gets another, right? So Uber says, well, to the guy, he's like, hey, you got your iPhone. How about this? In that 4 hours, why don't you just do a couple rides for me? I can't pay you with the other guy, but I don't charge the overhead. I'm only going to charge 20%. Just do a couple rides. You'll be back, an hour before your next booked run. The driver says, shit, okay, why not? Right? So he goes off, and then a bunch of us who have occasionally had our work bring us a black car, but most of the time don't. So to say, hey, my friend's actually, he rode a limo to the airport, but it was like not that much more than a taxi. It's this thing, right? So for those of us who have the time and the space, the flexibility, willing to not reserve in advance, the small sort of orphan subset of us that aren't a perfect match, get a little lift into the AMC space for a minute, right? And boy, it works great. The drivers love it. These new people love it. It spreads. Pretty soon there are more people wanting to Uber than there is excess space in the black cars. Right? There's the dude who tells his friend, sorry, PowerPoint behind here. Then what happens? There are all these people, they start going to drivers and saying, hey, I know you don't have a limo, but there's all these people who want to Uber. Maybe we could just get any old body who's got a car. Right? And the people say, well, it's not as good as the limo, but it's pretty good and it's a lot cheaper. In doing that, they brought a whole new price point. They brought a whole new late adopter. They got across the chasm, and they created an entire reservoir of excess supply. Remember, in the very beginning, the black cars did not feel like there was not enough black cars. Oops, I'm supposed to stay inside the couches. Right? They're like, no, we need less black cars, right? Less taxis because we need the business, even though we're sitting for 4 hours between. Because as it's packaged and priced, there's only 11 people who can afford it, right? But by creating both the reserve of excess capacity and the flexibility. So right now, those blue drivers up there, they get a tweet. We're at 2.0 right now. Maybe you should put down the remote and pick up the keys, right? And whoops, you have this explosion of capacity. You've also eliminated you've taken on competitively, obviously, an entire regulatory environment that kept the number of black cars and taxis small enough, right, to create high prices to, they thought, be able to, right? The only way, I have to charge a 90% margin for my mammograms in order to fund my research, right? Okay, now let's try healthcare. We've been trying to do this to healthcare at Athena Health for 20 years, and we're not. It's such a pain. This is our office in Belfast. So this is us getting, after 20 years of automating our clients, 30,000 pieces of mailed paper every freaking hour. And so, like Willy Wonka, since we couldn't automate the digits, we just built giant machines to read all the shite that Cigna sends us every day. We have automated. We are down. There's only about 8% of stuff that still hits paper. But 8% after 20 years, I feel like a huge failure. Network knowledge. Well, we know things about, we've been getting really good at understanding how insurance companies and other networks adjudicate payments. We got very good at that very quickly. But now we're starting, because we've gotten all these people on one network, to start to notice other things like, gee, ACOG comes out with this thing that says that if you put an fertile woman on an ACE inhibitor and she gets pregnant, you'll kill the baby. Gee, I wonder how many OBGYNs have put fertile women on ACE inhibitors. Turns out 68,000 of them. Oops, doctor, oops. So we little tweet to the doctor, hey, psst, these 70 women, we gotta get them in. And then we text the women, hey, calling on behalf of your doctor, can you come back in? We're gonna make a little tweak, right? Zika. These are the zip codes that have it. Do we have any fertile women in this area? Do we have any sexually active men trying to have a baby in this area? Yeah, we do. Hey, 2,000 of them, in fact, in those 2 zip codes in Miami. Text them. Hey, can you come in? Just quick test, public health office. Nothing to worry about yet. Could you just come in? And then could you leave for a long time? So we've started to kick in, and it feels great. But of course, the most important part is the resource allocation, right? We have so many empty beds. We have so many surgeons that spend so little of their time doing what they actually love and know how to do well. Subspecialty radiologists spend 8 to 12% of their time on their specific subspecialty. I got my knee fixed from the number 3 guy who does knees in Boston. He does 127 last year. It took him 45 minutes to an hour for each. The rest of the time, he's there fluffing on the side of football fields, looking for damaged kids, giving injections, leg lift, try this video. Desperate. Now, when he gets one, he gets $5,000, right? So how do we get it? So I'm like, well, let me just, out of curiosity, if I gave you another 200 on top of your 112, would you do it for $2,000? He took exactly no seconds. Like, absolutely. I love doing surgery. I get better at it all the time. If I could keep using the same, right now he goes to 3 different places because he wants to be in the cool referral network of each one. So he operates in 3 different operating rooms with 3 different teams of nurses and 3 different sets of tools. Okay, get out. Here's George. His name is Tom. Here's Tom. Get out Tom's tools. Make sure we got Tom's, dead guy's tendons in the freezer. It's just crazy, right? So what is it? Well, we talked about our surgeons. We talked about our hospital. We'll talk about our hospital beds. We have, 40% of them empty at all times, fully funded, pay their fixed costs. The incremental cost of someone being in them is like $12 for sheets and some bad Jell-O. Data centers, computer systems, we duplicate, right? And with our best efforts, even with all the things we do, every American college has many important clinical responsibilities, but they also have a business responsibility to make sure that there is a shortage of their specialty so that the people who go through the agony of getting boarded in a given specialty can make a lot of money when they finally find someone who needs an otolaryngologist or whatever, right? So yes, we got to block, we got to be busy, we got to have few of us. So you go in and you make an appointment. If you look in AthenaNet out for the next 30 days, it's tight, right? There's no appointments. 4.4% available, and you'd have to be ready at 7:32 on a, Saturday to get the 4.4% that are open. But if you look back, 20% of them aren't being used, right? Because the only way to get at it is through this sclerotic process, and we're used to this increasingly real-time, short cycle network-based allocation of resources that we've grown used to on Google and Yelp and everywhere. Click. So who are our Ubers, right? Well, one of them is Uber. So Uber's starting to give flu shots. Flu shots, the licensure requirement's quite low, but you can hit the button. This was in New York for a couple of days during flu season. They did something like, I forgot the notes, 17,000 flu shots in a couple of days, instantly. People who would have never gone and waited in line or made an appointment or, I hear that CVS, whatever. Fa-bam. Excess capacity that's cannibalizing the excess capacity that cannibalized the black car. Pager. Start up in New York. Got a couple cities. Hit the button. Doctor comes. You can see all the doctors around you. They're starting to say, but by the way, here's a nurse who's even closer. You sure you need a doctor for your cough? Number one diagnosis, reason for visit in primary care in the United States? Cough. Number one cure? None. You really want to talk to someone about your cough? How about Nurse George? He's 1 block away on a bicycle. He'll come to your office. Candescent. They're going around the country saying, hey, I hear you're running out of your wrist packs computer system is getting old. How about we give you one? How about we just take your images, put them in the cloud for free, and we'll do all of your quality measures on it for $1 an image. And if you have an image that you can't read within the time frame that you need, or you don't have a subspecialist to read that, we'll route your image to someone who is available right now and is in that subspecialty, and they'll read it and bring it back. And we're measuring their quality the same way we're measuring your quality, so you can believe that their quality is the same as your quality, especially since you were going to give the breast to the bone guy, and he was going to come in off the golf course sweaty to try to read it. And so all of a sudden, you end up with theoretically, if that were to progress through the Uber cycle, you would have more and more and more concentration. The breast guy could actually start to do only breasts, and the bone woman could only do bones, and pretty soon she could start to really build some excellence and some speed and some quality that would never be possible with all the idle time and then the sprint and the idle time and the non-specialty time. Sorry, too much anime here. And then what would the Uber X be? This is the big question. We're kind of at risk of a black swan in healthcare because we regulate. If the TLC was tight, imagine healthcare, all the boards and the certificates of need and the JCO and all of the licensure that you go through to talk about your cough. That's one of the things that's going through this elaborate regulatory infrastructure. Think about the 35% of total spend that is behaviorally determined chronic diseases that there are no doctor-created cures for, right? But they got to run through the system because something about their lifestyle got them out of whack. They crash. We need an ambulance. We need an emergency room. We need those. Those are not wrong or bad, but there's nothing about those things that do anything other than get them home and tee them up for the next crash. So what would the Uber X be? Well, I'm interested in the fact that home health seems to be exploding. That's interesting. That's one of the things that's draining those fixed costs. And one of the things I'm noticing in small hospitals, we're starting to do Athena in hospitals now, really small ones, is more and more and more of those hospital beds are not, they're technically not hospital. They call them swing beds. They're basically like, oh, you're going to go to the nursing home? Well, why don't we just make this nursing home? And we'll re-rent our black car at Uber rates rather than black car reserved rates. It's actually happening right now. They're called swing beds. 85% increase in the number of case managers. Interesting thing about case managers, if you think about these behaviorally determined drivers of disease, they're boarded in being a South Central resident. And that's more important clinically to somebody who's suffering from 3 chronic diseases in South Central than being boarded in internal medicine. Because the things that are preventing the person from eating right and relaxing aren't available in prescription form. They're available in the exhaust of someone who battled through it and figured out how to manage stress in such a life. And those people can't bill in the fee-for-service world. There is no license, there is no code. There is a code, but they're not allowed to send it. Only a doctor can. But in a risk environment, somebody who takes global risk, you can hire anyone you want to do those visits, as long as when they come in for an actual visit, you provide them one of these board-certified blah, blah, blah. But if you could actually create essentially an illegal visit, just saying, if you could create that illegal visit, if you could allocate those resources, if you could take all the black car capacity that is sitting right over here and swing it out, Uber it out when it's empty at a totally different price point for a totally different profile. Maybe we would actually have a healthcare internet. Maybe we would have a democratization of makers. Maybe we could afford what we consume. Just saying. Thank you guys very much.